I'm sure many of you remember, there was this iconic moment in August, iconic in a negative way, in August of 2020, where Chris Wallace asked Donald Trump, what's up with the health care plan you promised? And Trump said, within 2 weeks, it's going to be signed into law. It never was. Trump ultimately lost the election, and we know what transpired in the years that followed. Ron DeSantis is having a similar it'll be out in 2 weeks moment. This is just absolutely amazing. NBC News' Kristen Welker interviewed Ron DeSantis over the weekend, and she said, what's in your healthcare plan? I mean, really, like what exactly is in your healthcare plan? What about Obamacare? How are you going to get people coverage? And he said, well, you know, we're working on a proposal. Maybe it'll be out in the spring. Really? You don't have anything to tell us at this point, Ron, about how you're going to achieve what you claim you're going to achieve? Listen to this pathetic answer.
Can you tell me specifically what the plan is and what your plan is to ensure the 40 million people who now have health insurance who didn't before Obamacare was passed?
Well, we're going to be working on probably in the spring. We'll roll out a big proposal.
They're working on it super strongly. They need months to roll it out.
I've got a lot of input that's been coming in from a lot of good people around the country, but we will definitely be addressing insurance. We'll definitely be addressing big government, and we will be addressing big pharma. You know, we pay more for drugs in this country than anybody else in the world. I'd like to see some equity across these developed countries so that our consumers are getting relief. Obamacare promised that. It didn't deliver. So we're going to do something that actually works.
There you go. But he's not going to tell you the specifics of how it'll work until the spring. But fear not, he's having input, which is a great thing to hear. So this is the new, we're going to have a health care bill in 2 weeks from Trump from August of 2020. Now, here's the reality about health care. There's not this mystery. It's actually not the black box. So many of these elected officials want to pretend it's so complicated. I need months to study it, even though I've been in elected office for a long time. There's a triangle, okay? And the late healthcare policy analyst Uwe Reinhardt wrote about this in his posthumously published book. Imagine a triangle. Triangles usually, by definition, have three points, axes. I don't even know what the right word is. Okay. There's 3 points on a triangle. They are cost, quality, and access. Cost, quality, and access. And what healthcare systems attempt to do is to find the point on that triangle where you feel like you're doing the best you can for the people in your country. There's not really a trick to it. There's not a trick. Usually, if you want lower cost and greater access, quality will suffer. If you have a certain quality and you want to expand access while holding quality level, the price is probably going to go up. Now, that doesn't tell you who pays for it, how is it funded, what about eliminating bureaucracy, all of the, but this is the basic framework that we have. And so it's becoming a gotcha to ask these Republicans, what's your healthcare plan? They want to pretend it is very complicated, but it's not complicated in the way they want you to believe. In a way, there is some framework for figuring out what you can do. And when Kristen Welker tries to ask more about it, it only gets worse, and it is word salad after word salad. Listen to this.
President Trump said he wants to repeal and replace Obamacare, something he tried and failed to do when he was president. You were in Congress at the time. If you were president, would it be your plan to try to repeal and replace Obamacare, something you voted to eliminate 3 times?
Well, you're right. President Trump promised that he would repeal and replace Obamacare, and he didn't do it. And that was a promise that he made a lot of times.
What would you do, Governor? What would you
costs
do?
have continued to go up. Well, but I think it's important to point out he's running on a lot of the things.
What would you do? Talks about Trump.
He campaigned on in 2016 and didn't deliver it on, whether it's repeal and replace Obamacare, whether it's building the border wall, whether it's draining the swamp. Remember, he said he would do a special counsel against Hillary Clinton. Then 2 weeks after the election said no. Now he says he's going to do one against Biden.
Understood,
so
but
this
Governor,
is part of a
what would you
pattern
do?
where he's running on things that he didn't do. Here's what I will do. What I think you're going to need to do is have a plan that will supersede Obamacare, that will lower prices for people so that they can afford health care.
Oh, he's going to lower prices. Cool. Okay, sounds good.
While also making sure that people with pre-existing conditions are protected. And we're going to look at the big institutions that are causing prices to be high. big pharma, big insurance, and big government. But it's going to need to be where you have a reform package that's going to be put in place. I don't think that repeating what Trump did and the failure is necessarily going to make sense. So we will address that. We will make sure that the Obamacare promised lower premiums. It didn't deliver that.
You guys understanding what the plan is here? Is there a plan here? It doesn't sound like it.
We know we need to go in a different direction, but it's going to be done by having a plan
Governor,
that's going to be able to supersede it. And
Governor,
we will be working on that.
I want to be clear by what you mean by supersede. Do you mean you will move to repeal Obamacare and try to replace it with something else, or will you leave it in place and make revisions?
No. You will have a totally different health care plan.
So you repeal it?
But what
You'll
it will
move
be
to
is
repeal it?
people that will be on things like if they have
How many times does she have to ask the question?
an exchange plan, we'll have a plan that will offer them coverage. So the coverage will be different and better, but they're still going to be able to be covered. So we want to make sure we have as many people covered as possible at the lowest possible price.
That's the plan. Cover as many people as possible at the lowest possible price. Super creative, right? These are not serious people. I hope that this makes it obvious to any voter who thinks, oh, DeSantis is more serious on policy. He is not more serious on policy. By the way, I just got my renewal for my insurance next year. As some of you know, because I'm self-employed, I just buy my insurance through the New York State Health Connector. So these are not good plans. And I don't blame any one in particular. These are just not good plans. The system is really designed to be for people with employers where the employer might pay half or 2/3 of your plan. I don't have any of that, right? I'm paying for the plan myself. In 2023, my plan is $591 a month. This is just me, by the way. This is just me. $591 a month. It's pretty crappy. So I think I pay like $30 to go to my regular doctor and $60 for any specialist. My plan is going from $591 in 2023. I just got my renewal notice. It's going to $700.21. $700.21 in 2024. And at a certain point, I'm like, should I just be switching to the cheapest plan, like one of these catastrophic care plans where I have some deductible. I just pay everything up front until I hit that deductible, and then the plan takes over. Because I'm doing the math, 700 times 12 is $8,400. If I can find some plan where I pay the first $4,000 or $5,000 out of pocket, and then it covers everything, maybe I'm coming out ahead. I don't know. Needless to say, the plans for self-employed people are very terrible, very, very terrible. But it sounds like Ron DeSantis doesn't have, by the way, if DeSantis communicated something I believed actually showed he understood the problem and might improve the situation, I'm in a situation where I would love someone to propose something that will help me. He's proposing nothing. It's obvious that he has no idea what he's talking about. So there's his, it'll be out in 2 weeks moment, just as disappointing as anything we've ever heard from Trump. Breaking bad habits can be really tough, but Fume is on a mission to make it a lot easier. Now, let me again remind everybody, our sponsor Fume is not a vape. I would not be advertising vapes. There's no nicotine. There's nothing electronic. Fume is just a small wooden cylinder that delivers tasty plant-flavored air. That's all it is, okay? First of all, people love the flavor, bunch of flavors, crisp mint, maple pepper, orange, vanilla, raspberry, lemon. Okay. There's the physicality of the device. It fits in your pocket. You carry it around. It gives you something to hold up to your mouth. So if you're breaking a bad habit, the hand to mouth piece of it is a big deal. Your hands want something to do. This gives you that. It also has an adjustable airflow dial and a magnetic end cap, which you can just fidget with when it's away in your pocket, which is also useful for some people who are trying to break these habits. Just go and read the reviews online. Fume has transformed bad habits for thousands of people. It's a great alternative for the hand-to-mouth habit. Start the holidays off right with a good habit. Go to tryfume.com/Pacman to get the Journey Pack today, which comes with the device and several flavors to try. You'll get 20% off all the way until December 1st when you use the code PACMAN. The link is down below.